Hi, my name is Dr. Surekha Tiwari. I'm a practicing homeopathic doctor and a psychological counselor. I practice in Bangalore and I have two clinics, one in HSR and one is in AECS layout. Depression, anxiety, fear, panic attacks. These days I'm realizing that people have started naming a mood. Anxiety is a mood. It can be because your child hasn't come home, because you see that your child is developing some pimples. You can have fear because you realize that corona is creating a lot of anxiety, a lot of unknown territory within us. Corona is unknown, right? We doctors have been telling people that it is the oldest family of a virus. It has been there from time immemorial, but still the media, the news around you, the talks all around you centers around corona, and because it's an unknown territory, so we all have a certain sublime fear running through all of us because we are feeling very, very unsure. What is right, what is not right. Now you don't know, 1,000 times a day you may wash your hands with the sanitizer, but you still are not very sure, are they clean? Then you read about articles about that immunity is very important, right? Now how do you get immunity? So you're getting all the concoctions under the sun. You've got garlic coming up, ginger, and in the name of all these concoctions, I as a doctor am seeing a lot of disasters there too. Diarrhea, piles, all those things can happen. I would actually say that, first of all, if you see feeling sad, you're just feeling sad, you're not depressed. It's a mood, it will pass by. All these things have triggers. If you're able to understand your trigger, address that trigger. One fine day somebody comes up and says, my sugar has shot up and I think I'm diabetic and the rest of my life I can't eat desserts. Now this is a panic attack. How about going to a doctor and the doctor says that until and unless I see 3 consecutive readings which are high, I will not conclude that you've become a diabetic. And while you're doing those 3 readings, why don't you start going for your walks? Why don't you make sure that you're eating the right kind of food? And why can't you make sure that you control your weight? Overall, after the 3rd reading, you may conclude, okay, that was just a spur. But the problem is, panic attack is very immediate. Today I get to know something and I'm responding. And because I'm not allowing myself response time, so the response is very, very fearsome. And then I start telling myself, I suffer from panic attacks. When the first time you had after the calming down, you just sat down and realized why, what exactly happened in my head that I had this, you will not suffer. Please do not label the various emotions where your whole psyche will go through, and negative emotions scare us. There is nothing to be afraid of corona. You can deal with it by just simply raising your immunity, taking all the hygienic cautions. You don't have to be having depression about what is going to be your life. It was never like this. There is a very old saying in the Darwin theory, change is the only thing which is permanent in life. Remember, these times will change. The anxiety is only driven by the fact that you do everything and yet you're not able to trust your actions. Please trust your actions. If you've done all the right things, if you're eating all the right food and you're taking the right actions, you cannot be harmed. Beyond this, if you don't think that you're getting better, please talk to your friends and family more openly. Let them know what you're going through. And still, if you still find you need help, instead of reaching out for medicines, please approach a counselor. They will be able to allay your fears. You don't have to live with them. Okay? All the best.